So this afternoon, we are joined by Representative Susan Brooks. She is the representative currently in the Indiana's 5th District. Thank you for being with us this afternoon, Representative Brooks.
Pleasure to be here, Deena. Good to see you remotely.
Yes, absolutely, our new normal.
I hope we never get completely used to it, but I think we're in working this way for some time yet. Until we get to really a lot more folks get those vaccinations and get people vaccinated.
I would have to agree with you on it being our new normal. So a little background on Representative Brooks. Prior to being elected to Indiana's 5th District, she was a U.S. attorney representing Indiana's Southern District, and she resides in Carmel, Indiana. Representative Brooks, in June, you told us that you were not going to run again. Can you give us a little bit of insight on what helped you make that decision?
Actually, it was June of last year. It was quite some time ago. And I am one of those members that came into office when I was running saying that I was going to term limit myself. And I've actually done it. I said that I would serve, somewhere between 8 and 12 years. And I thought that was what folks that I had been talking to around the district felt like maybe that would help Congress if more people didn't stay there so long and if they would term limit themselves. It was a perfect time in my life when I ran. My son was headed off to college. My daughter was graduating from college. The joke in the family was that instead of becoming an empty nester with my husband, I flew the coop also and decided to go to D.C. But now, fast forward 8 years, I have loved my time in Congress, but I believe, again, not just because of term limits. I went there not with specific things in mind to accomplish, but I had hoped to restore some confidence in Congress. I hope to work on important things for the 5th and then pass the baton to the next person who, wanted to put the energy and passion and dedicate their lives for a while to representing the 5th. And I'm proud of that. I and my team have worked very hard for the last 8 years. And it's time for me, quite frankly, to be more of a family caregiver, to get more engaged with, parents who are older, in-laws who are elderly, and to start, slowing down a little bit.
Well, we certainly appreciate the time and the dedication and that you've given to Indiana's 5th District and the state of Indiana. And I'm sure that it's going to be a warm welcome back home for you and your family members.
Well, thank you. It is, and I am looking forward to it. Although our work in Congress is not finished, and we have more work to do because government funding runs out on December 11th. So I'm still very hopeful that we're going to be able to get a funding package and, honestly, another COVID relief package done. I thought, and I'm very, very disappointed, I had thought we would have gotten it done in June or July, before we went home for the August break, and it didn't happen. And I think that's in large part because it was an election year. But now that the election really is behind us, I hope that we can, all of the players can come together, and it's usually driven by the leadership. I wouldn't say normally, at the line level of members. It's those packages are usually put together at the highest levels.
Sure. Wonderful. Well, we all are, I think, eagerly anticipating that next package that's coming out of D.C.
Well, I certainly hope. It's my understanding that Senator McConnell is working on something. I know that a bipartisan group of members from the House and the Senate unveiled a package yesterday. So what I see this week in particular is that there is some movement. There are more discussions. Papers are being exchanged with ideas. And so I just hope that we can do something. rather than instead of getting an entire package that either side wants, there are certainly things that we agree on. One of, I think, the low-hanging fruit pieces of any package is there actually is significant billions of dollars of funding for the Paycheck Protection Program that haven't been utilized, but the program expired. And so we ought to be taking that funding that we already appropriated and pulling it forward and using it now, because we know that small businesses and people really could use that help to keep their employees, on the payroll.
Absolutely. I concur with you completely.
Yes, I really hope that the Paycheck Protection Program is re-energized and continues to be funded for many months. This isn't going to be something that we're going to, see tremendous differences in January and February. So I think we need some sustained funding. And then also people who are on unemployment, giving them assurance that those unemployment benefits are going to be there, maybe a small bit more of unemployment. Those are the types of things. Of course, I would love to see some liability protection, particularly for our hospitals and for our businesses that have tried to open. Everyone's trying to do their best, and I don't think people, should be sued, or companies should be sued if they're trying and implementing a lot of safety precautions.
Sure. While you've been in D.C., Representative Brooks, the 8 years, can I ask you to just reflect for a few minutes and share with us, with regards to the changes that you've seen, which are you most surprised by and which ones are you most concerned by?
Well, I am. I'll start maybe with the concerns. What I'm concerned about is, while I have been in Congress, there have been far too many government shutdowns. We have had far too ineffective of budgeting processes, and we cannot quite seem to get our act together as a Congress to continue to fund government when we need to get it done. I think we ought to consider, and I've been part of something I'm really proud of, a select committee on the modernization of Congress, like our state legislature that does biennial budgets every other year. I think Congress ought to be doing that rather than once a year. We get so bogged down in those spending bills. I think we could move federal government, like many state governments have moved, to biennial budgets. I think that would be critically important. And I've also been very concerned about the division, particularly in the country, often fueled through social media. So much of what people say and do in angry, nasty ways is through social media. It's often not in person or one-on-one, but I think people say and do things on social media that they wouldn't do in person. And so I hope that civility and respecting differences of opinion, we need to find a way forward in order for our democracy to survive, quite frankly. But then to be things that I'm surprised about in a very positive way. I had never worked on the Hill. I had never worked in Washington, really. And what I was so surprised about was actually the collegiality of the members themselves. So members of Congress from all across the country, very, very different backgrounds. They represent very different places. There's a tremendous camaraderie and actually a lot of friendships that are developed. And I think that is the foundation of bipartisanship. And that is, I think, the foundation of where we need to focus more time and attention and create more of those opportunities for members to be together. Most of them don't live in D.C. anymore. They don't spend time there. Once votes are over, they're out of there on the next plane home because our constituents require that and expect that. But I think we've got to do a better job of fostering more of those discussions because we have a lot more in common than we disagree on.
I can appreciate everything you just shared.
Thanks.
With regards to what you're going to miss most, can you share with us what that looks like for you? 8 years is quite a while to be able to have your finger, if you will, on the pulse of what's going on, and you bring such wisdom to your position. You have such great insight. What most are you going to miss about that?
Well, and thank you. It is interesting that you say, you have your finger on the pulse. It is interesting to watch the news every night. I actually flip between the channels to see how they're reporting what I believe happened during that day or what I heard or saw happened during that day. And so I will miss, as you've said, kind of being in the mix and kind of getting some inside perspectives on it. But what I'll really miss, and I have thought about this quite a bit, I actually will miss traveling the district and interacting with everyday Hoosiers and listening to them, what they're concerned about, helping them, whether it's a farmer, whether it's a hospital, whether it is a local government official, whether it is a veteran. I love problem solving and I love trying to help people and or, entities. And I had a fabulous team that I really enjoyed working with. I'm going to miss that team that I've had daily interaction with over the last 8 years. And about half of my team have been with me for 8 years. So they're more than just a team. We've been a family. We've been through a lot together over the last 8 years. So I'm going to miss them, and I'm going to miss them, helping our neighbors.
I can appreciate that. While you've been in Washington, D.C., you were assigned to the Energy and Commerce Committee, and I believe that you were sitting on the subcommittee for health. And I'd like for you to share with us a little bit of insight about what that committee does and some of the positives that you've seen come through that committee with regards to health.
Well, when I came to Congress, the opioid crisis was raging. And I will tell you that is something that our committee, the Health Subcommittee, has worked on extensively. And that's one of my prouder moments is that committee took about 100 different bills proposed by different members of Congress and packaged them into a big package called the CARA Act. And so we spent a lot of time and a number of years trying to tackle the opioid crisis. I will tell you, I've been very, very concerned that with COVID, a lot of people and progress that we made over the years that we will slip back into the addiction crisis that we've had. We also focused a lot on mental health. And again, I think with COVID, that is going to also be something that we're going to be dealing with for some time. Issues around telehealth have been exciting. That'll be one of the positive things that comes out of COVID is that people are now so much more accustomed to telehealth opportunities and visiting with their providers and getting services, through their computer or through the telephone. And I think that, so we kind of pulled some medical technology and people's being accustomed to it into the 21st century. But then the other thing that I particularly worked on, which I truly did not have a crystal ball to know we would actually be dealing with it, was I worked on pandemic issues before COVID hit. I was the Republican lead on a bill reauthorization of what's called the Pandemic All Hazard Preparedness Act. We got that signed into law in 2019. And that's what funds those strategic national stockpiles across the country. That's what works. That's the funding that we use to work with pharmaceutical companies to stockpile therapeutics and vaccines. And so I was working on that before the pandemic really hit. And while I'm really pleased that we worked on it, we clearly had not done enough, and not enough people in Congress really paid attention to our biodefense efforts. So those are some really big things that we worked on in the Health Subcommittee. One other really big issue is maternal mortality. I really had no idea what a serious issue it was in our country. And Indiana has really struggled with maternal mortality. We've often focused on infant mortality, but we've not focused enough on the fact that we actually have a lot of, young mothers who die after childbirth. And what do we need to do in our healthcare systems to improve that? Because we do have the best healthcare system in the world, so we shouldn't have people dying and young moms dying. And so those are really important things that I'm proud that we worked on together.
Before you left for DC, I know, if I'm not mistaken, that you sat on the board for St. Vincent's Ascension, and that you had the opportunity to get a good grasp of what exactly is going on in the healthcare setting. Many of Indiana Rural Health Association's members are rural hospitals and rural clinics. And as you're well aware, COVID-19 is certainly taking a toll. I'm sure you're watching the numbers back here in Indiana. We are trajecting the wrong direction, unfortunately. While that is occurring and you're sitting in DC and you're listening to some of the conversations, can you share some insight on some of the fears and apprehensions of your colleagues with regards to what exactly is going on with COVID?
I think, unfortunately, and with Indiana specifically, and I actually think that Speaker Houston, I just recently read that Todd just said COVID is shining a huge light on the healthcare problems we have in Indiana and the health challenges that Indiana has specifically. And I think we have far too high of rates of obesity and of diabetes, and far too high of smoking rates. And all of those things are really horrible if you contract COVID. And they exacerbate if you get this, novel, horrible virus. So I think what we have seen is that we also have not invested nearly enough in our public health infrastructure. And Indiana in particularly has not over the years invested enough in public health. And that relationship between hospitals and public health is critically important. I have so much respect for our hospitals, the rural, suburban, and urban hospitals, but I know that our rural hospitals really often service, as you all have educated me, with such wide geographic areas. And yet we have a tremendous difficulty sometimes getting providers to work in our rural hospital settings. And that is a huge challenge for us, are those workforce issues. Well, we're seeing now significant workforce issues with COVID. And I know that our rural hospitals already started at a disadvantage with the workforce shortages that you have. And now with COVID, particularly if people have been exposed and they have to quarantine, if they have contracted. And I know that we had significant issues with PPE at the beginning of COVID. Well, we're not through COVID, and we have to make sure that our rural hospitals in particular have the PPE to keep all of those absolutely essential workers healthy and safe. This has been a tremendous, tremendous challenge. And it's one that my colleagues and I are very concerned about. We have to make sure that our rural hospitals have the resources they need, that if the rural hospital is part of a bigger system, whether it's Ascension or IU, they often have supply chains that make sure that those rural hospitals get the supplies they need. But if it's a freestanding rural hospital, I know that those freestanding independent rural hospitals have really struggled to make sure that they had the PPE and the supplies that they've needed. So these are the things that we do worry about, that we try to make sure that there are resources for them. But it wasn't always, and then when we had to put a pause on elective surgeries, that has caused a huge problem for the bottom line as to whether or not those rural hospitals could even stay open and meet payroll and pay their bills. And I know that most people don't really appreciate how hospitals are run, but they have bills to pay also. They have to pay their staff and their incredible workers. And I want to just take an opportunity right now to thank all of the incredible frontline healthcare workers, whether or not you are a doctor, a nurse, a technician, a cafeteria, food server, the janitor, anyone who works in the hospital is doing an incredibly important job and are really truly are those frontline heroes. And I want to make sure I thank them from the bottom of my heart, not for our constituents, because I know they've been doing double and triple duty. And then if people on their teams get sick or are quarantined, they are just really picking up the slack. And so just want to really thank them and their families for sacrificing.
Well, I will surely make sure that they get that information as we distribute this. So I'm sure all of them will be very thankful to have your gratitude, because they are so many that are working very diligently to take care of our rural Hoosiers.
Well, and now that we're going into the holiday season, and while I know many of them would love to take a break and have off because of the surge and because of the number of cases right now, that's just not possible. And we need them now more than ever. And, I hope that people have been incredibly careful during the holidays, whether it was Thanksgiving or now coming up on Christmas. This is just a really different year. And, we will get through this, but nobody sees it. And I've talked with frontline workers, and they are holding up iPads to share with a hospital patient, with family members. They're communicating. They're often the only ones there when family members can't get in. It's been a really emotional, difficult time for a lot of those providers. And I, just want everybody to just thank them and appreciate them.
We will certainly pass that along. Today we heard, actually I believe it was yesterday, I apologize, that the Trump administration had finalized permanent expansion of Medicare telehealth services and improved payment for time doctors spend with patients. That's a pretty big deal during this time of COVID-19. Were you as a Congress member able to weigh in on that? And if so, can you share how?
Well, what we have done, there has been a focus on telehealth for actually quite a number of years since I've been in Congress. We know particularly for the rural communities, and it is often the rural members who represent rural areas who are the biggest proponents of telehealth. But part of the challenge was that providers were not getting paid the time that they spent and making sure that they got paid for those services. And there was some disparity there. And so I'm really pleased that the Trump administration has changed that rule. We have Hoosiers who are leading that charge. Secretary Alex Azar, a Hoosier from Indianapolis, has been head of HHS. And then Seema Verma from Carmel has been the administrator for CMS. And CMS is actually the one that typically makes those changes with respect to how providers are going to be paid. And so, I'm proud that as they are finishing their service, I'm proud that they're making some really important, lasting changes. And members of Congress, we write letters, we sign on to bills, we advocate for it. Those are the types of things we do to just pressure, nudge, encourage the administration. But I'm really pleased that rather than waiting for a certain piece of legislation, and in CARES for COVID, we did put more funding toward telehealth services. But now to say that they're going to change the way it's funded permanently is, I think, really important going forward. I don't see that getting rolled back. I think that is 21st century medicine.
It's exceptional. We appreciate it. For just a moment, if we may, Representative Brooks, with regards to the current situation in Washington and the fact that there's been no resolution regarding the presidency, at least for many Hoosiers, there has not been a resolution yet. It's been a bit unnerving, if you will. Can you share from your chair what you see and how you see things unfolding? And I know you don't have a crystal ball, but just some reassurance, if you will, for Hoosiers who felt so very passionately about going out and voting on November 3rd.
Well, I will tell you that people have forgotten that in some ways our country actually has been here before. President George W. Bush was not named, if you recall, going back to the Bush-Gore, the hanging Chad fight in Florida. Our country has been through recounts and challenges before. If I'm not mistaken, it was mid-December before George W. Bush was named the president and named the winner of that election. I think what is different here is that you have an incumbent president who, in the vote tallies, has appeared to be behind, and he exercised his legal right to challenge and to explore, anomalies in elections and to try to figure out whether or not all legal votes were counted. And that was very important. Every state has a process in place that he and his legal team explored across the country and, challenged at over 6 states, if not more, entered into real legal challenges and entered into recounts and audits and so forth. And that is his legal right to do so. And I think what we have seen, though, over the last week or so is that he has not been successful in those challenges in a number of states. And so, therefore, we are coming up to the time where the Electoral College votes will be cast. And it does appear that President-elect Biden, Vice President Biden, is the president-elect. But I believe, and because of the manner in which our government has been established, there is a transition period, and that is why I do believe it is important. We learned this after 9/11. It's very important from one administration to the next that there is a safe and a peaceful transition in that power, in that we need the next administration to come in with some knowledge of what is happening in government rather than starting completely cold on day one. On I believe it's January 20th or 21st. I haven't looked. But I commend the Trump administration is allowing the Biden administration to begin to receive those briefings, whether it's on national security, on COVID. That has begun. And I think we'll be fine. I think there will be a transition. But, President Trump is not completely finished with all of his legal maneuverings, which are legitimate and are allowed under the law. And so I think that's where things stand at this point. And, I just believe I'm only in office until January 2nd. And then Victoria Spartz. Victoria and the incoming members of Congress have been going through orientation and transitions. And that's what's important. And she and I have certainly talked many times. And I'm probably on her speed dial. We're talking quite a bit to make sure that we have a successful transition for the folks of the 5th.
Very good. That was going to be my next question, is how that transition for the 5th District is going to look. So excited to hear it's going to be smooth.
It's going to be very, very smooth. I'm very excited for Victoria. She has a very unique story. Certainly in Indiana, having come here as an immigrant 21 years ago and becoming a citizen, and a citizen so passionate in fighting socialism, and that was her main message. And that's where she is concerned that if we don't rein in some policies being proposed and discussed, that our country could go down a path that she has experienced, and she does not want that to happen. I love that she comes from the rural part of the district, and that she and her husband, who are farmers, really understand rural America in many ways, and rural Indiana. But I think she's going to, do a really nice job. She's incredibly smart, incredibly hardworking, passionate about our country, and she's putting together an excellent team. And so I'm on her. I lead her transition team, which I've been honored to do. And some of members of my staff are on that team. But she, again, is bringing in fresh ideas also, not just taking what we did. She's absolutely putting her own stamp on it. She'll have her own team. And I know they're going to work tirelessly for the 5th. And that makes me feel really good. In fact, it made me feel really good. And I think we've turned a corner. 2 women competed for my seat. Christina Hale as a Democrat and Victoria Spartz. That's who came through those primaries from both parties. And I think that's kind of a new day in Indiana to have that many women. And there were multiple women in both parties' primaries competing for this seat. So I hope we see more and more women choosing to step up and run for office at all levels. That's something I'm passionate about. And something I'm going to continue to be involved in.
Wonderful. That's great news. I'd like to focus a little bit, if you will, on communication. Your office has always been wonderfully available when we have requested time with you. So first, let me say thank you. Your gracious time allotment to us has been much appreciated. A lot of the Indiana Rural Health Association members are very involved in making sure that they're doing the best that they can for the constituents that they serve. One of those areas that we would like to see more investment in is reaching out to federally elected officials and sharing what it is that they're seeing, what their needs are, concerns that they have, etc. Can you share with us from your office's aspect the best way to communicate how you'd like to hear from folks and topics that are near and dear that you would love to hear from more individuals from the 5th District out of?
Well, I would say, and thank you so much to you and the association for your advocacy, because it matters. It doesn't just matter to me, but I have staff members that have so much that they have on their plates that when folks like yourself and the practitioners come in and advocate and share with us information things that are important to you, it really helps educate me and my team. My team and I cannot learn all of these things. We can't keep track of every bill that's been filed completely in the House. And so you all zero in on the bills that matter to you. You educate us on the issues. And so whether it is virtually or whether it's in person, we always prefer in person. But when we can't, don't underestimate the value and the importance of telling the stories. And so, not just coming in and, this is a CMS code we're not happy with, or this is a rule that we're not happy with, but giving us the actual stories of how it's impacting you and telling us, what the practical impacts and effects are of a bill or a regulation. And then there's nothing, I think, to replace the visits, whether it's to a healthcare clinic or whether it's to a hospital. And so reaching out, particularly, for instance, to Victoria. Now, yes, she's been a state senator, not too long, but touring hospitals and touring clinics and having the opportunity to meet with the staff who were there and asking them questions, those types of things have huge impacts on us. I would also say that as a if there are ever any emergency preparedness exercises that the hospitals do, participating or being an observer in those exercises. Those always leave really impactful, impressions. But also talking to patients. I think that, having some patient testimony and is always very important. Because and healthcare, I know, is going to be a top priority of Congresswoman-elect Spartz's. She ran on that. Healthcare is going to be of significant concern to her during her time in Congress. I think it can be a very bipartisan issue. Most of these healthcare issues don't affect a person, whether they're Republican or Democrat or independent. And we got to find some better ways forward to make healthcare more affordable, more accessible, and make sure that, everyone has good healthcare in this country, and particularly in our rural areas. So having people reach out when there are big bills on the floor, we do pay attention to the numbers of calls that we get or the number of emails we get on a subject or the letters written to us. All of that advocacy does add up and it does matter.
Very good. Wonderful. Thank you so much. I certainly appreciate that insight. Well, we've taken about 35 minutes of your time, Representative Brooks. I'm going to give you the opportunity to have the floor for closing comments. So if there's anything that you'd like to share, now's your time.
Well, thank you. And thank you, Deena, for giving me this opportunity. Wonderful to see you, through Zoom, our new meeting place and space. And thank you to your team for setting this up. I'm really proud of my team that I've had over the years. I've had outstanding staff members who have focused on healthcare, and so I just want to thank them as well. But I want to thank all of the providers, as I just said, and all of the healthcare workers for what they are doing during this unprecedented, historic, once in a century, I hope, is all pandemic. And I think that the whole world and our country, certainly, and your neighbors are all getting a glimpse as to what your world is like. And I think we have a whole new appreciation for healthcare workers and for those in the healthcare system. I think when it comes to rural healthcare, there are more challenges than in other settings. And so, but yet I think rural healthcare workers and the rural community I represent in the 5th, that I've been really proud to represent, are the most resilient. They are typically the most tech savvy. They are the most innovative of the constituents that I represent. And they love helping their neighbors. And so just want to thank all of those in rural healthcare for what you do. Thank you so much. It's been my honor of a lifetime to represent the 5th, and I will miss being in the middle of solving problems, but I'm going to support Victoria completely and try, and I think you're in very, very good hands with Congresswoman-elect Spartz.